Hi friends, Tony DeWitt here, Missouri appellate attorney and a guy who likes to make the law make sense on YouTube. Here's what we're discussing today. Adulteration. It's an ugly word. It basically means defacing or striking something out, making it something other than what it is. Well, there is a physician in Dallas, Texas, who has spent the last year in jail on federal charges that he adulterated bags of IV fluid. And he adulterated them with, among other things, the drug epinephrine and the drug bupivacaine. It's a really twisted tale, and the trial has gone on. The defense only recently rested, and the jury is supposed to get the case today, April 11th, and we'll have to see what actually happens in the trial in terms of whether he is convicted or not. But here is what happened. At this little one-day surgery clinic, an outpatient surgery clinic, people were having the kinds of surgeries that you have there. Those are things like wart removals, nasal reconstruction, minor surgeries that still require or may require general anesthesia. Apparently, this doctor, who had a disciplinary record that was quite a bit longer than he led anybody to believe, and in addition to that, he had at least a misdemeanor criminal record. Apparently, he had been involved in domestic violence incidents, and when one of his neighbors allowed or helped his domestic partner escape the domestic violence, as retribution for doing that and for testifying against him, according to media sources, he shot the man's dog. And so he was arrested for that long before this happened. So there is some suggestion, at least based on that maybe the guy wasn't wrapped too tight to begin with. But be that as it may, he was a board-certified anesthesiologist, and he was working in anesthesia at this surgery center. So apparently what happened is they would put somebody under. One kid was 18 years old. They brought him in to do a nasal reconstruction. He had an accident on a motorcycle or a dirt bike, I guess it was.
Blood pressure.
And he'd injured his nose. And a lot of times when you break your nose, even though the bone will heal, the nasal passages, the septum and stuff get diverted. And so you do need to have reconstructive surgery in order to fix the defect that's in your nose. He goes in for this surgery, and all of a sudden his blood pressure spikes. He has all kinds of problems, and nobody can figure it out. So over the course of several weeks, when this kept happening, they eventually were able to tie it to the IV bags. Somebody was adulterating the IV bags, and basically they were injecting them with different drugs. One of the doctors who worked there, who was also an anesthesiologist, took one of the bags home because she was sick and she was dehydrated and she wanted to rehydrate herself so that she could feel better. When she put the IV in and started to run the IV fluid, she began to get sick. She hollered for her husband. She said, "Call an ambulance, I'm sick." And then very shortly thereafter, she went out. Her bag had been adulterated with the drug bupivacaine. Bupivacaine is a lot like the anesthetic agent lidocaine. Now, lidocaine is often given intravenously in heart cases because it helps alleviate some of the arrhythmias that go along with a heart attack. So it's not unusual to give lidocaine, but bupivacaine is greatly different than that, even though it is in the same class of drugs. If you give a toxic dose, which you would give by virtue of IV, if you gave a massive dose of that in an IV, it would essentially shut the heart down. And even though they would attempt to resuscitate the heart, usually the heart was refractory to being resuscitated as a result of that. So they started having all of these things associated with this particular surgery center and the IV bags. And somebody put two and two together when they were able to pull this IV bag off of the kid that was having the nose surgery. He immediately started to improve, and they found out that his bag had been adulterated with epinephrine. And of course, epinephrine is used in local anesthetic to essentially close down the venous structure so that the blood doesn't get through there as quickly and the anesthetic agent stays in place longer, so that you get a longer lasting bit of anesthesia when they're doing like stitches and stuff like that. Well, in this particular case, the epinephrine, when it was injected IV instead of intradermally in the skin, it was like being scared to death. Your heart rate jumped up to, I guess it went up almost to the 200s, and he was really, really sick. They pulled the IV out. They started flushing his system with regular, normal saline, and he got much better, but he still wound up having to be hospitalized. They sent him out to another hospital. It took him 3 or 4 weeks to recover. One guy was 78 years old that this happened to, and it took him more than a month to recover in the hospital. So these are very serious kinds of situations that were being reported, and they couldn't figure it out. And then they started looking at the surveillance footage from inside the surgery center, and they found that this doctor, Dr. Ortiz, was consistently removing bags from the warmer. And of course, in a surgery center, they keep the IV fluids in a warmer to keep them warm so that people don't get cold while they're on the operating table. He would take a bag out, and then he'd bring it back a little bit later and put it in. He'd take another bag out, put it back in. They had him on videotape. They had him messing with different drugs and syringes, but of course they couldn't tell exactly what those were. And eventually they put enough of it together that the federales brought a case against him for adulterating these IV bags. But here's where things get interesting. When they recovered the bag that was on the outside of the IV bag that had been adulterated and that had been given to the young man, they sent it to get fingerprinted, and it had one fingerprint that was different from Dr. Ortiz. So his fingerprint wasn't on the outside of the bag that was used. Now, it doesn't take a genius to figure out that if you're going to do something as evil as adulterating IV bags with drugs that will kill people, that you would probably use gloves, which are in abundance at a surgery center, to keep from putting fingerprints on the bag. But the defense has been playing that up a great deal. And as is often the case, especially in medical malpractice cases, they have been able to find an anesthesiologist who swears that all of these events can be explained by other causes and that it's just a bunch of bad luck all coming together at once. It is, in my opinion, a real shame. Now let me back up a minute. I do think it's important for people to have a defense, okay? And the defense is, I didn't do it, but I don't know who did. And I can't prove who did it, but I know it wasn't me. So you put somebody up on the stand and you have them testify, and you know, he explains that, yeah, I was checking the serial numbers or whatever it was on the bags. There could be a number of alternate explanations for why these bags are adulterated. But what you don't do is you don't hire an expert to come in and essentially get paid to, I hate to put it this way, but he's being paid to lie. I mean, there is no way that all of those things clustered in that one surgical center and those bags somehow became adulterated by some other means. I think what this doctor is testifying is that those bags were not adulterated. The bag that killed the first anesthesiologist, the bag that killed another patient there, none of these bags were actually adulterated according to this doctor. Among other things, they could be explained by the medical history of these patients. And to a certain degree, there is some of that. I think in some cases, their prior medical history certainly contributed to the problems that they were having because of these drugs. But you don't go from having a completely normal heart rate and blood pressure to having something way off the charts and then find epinephrine in that IV bag and tell somebody that, well, it was the rotation of the planets, the gravitational forces of the moon, or whatever it is you think it is that caused this. I mean, there's a very clear cause, and it doesn't really seem to me to be something that an expert should really be able to testify about, but the court apparently allowed the expert to testify. Now, the federal government does not like to have experts in their cases because if it becomes down to a battle of experts, if one expert says this and another says that, well, that is almost immediately right there reasonable doubt. The problem for them, for the defense in this case, with the reasonable doubt is the video that shows him pulling these bags in and out, and he did not testify at trial. And of course, that's actually a smart move on the part of the defense. You never want your client to testify in one of these cases because they'll be subject to cross-examination. And there is almost no way to beat a competent cross-examiner in a case like this. I mean, Alex Murdaugh probably had the best chance of anybody at beating a competent cross-examiner, and even he couldn't keep his lies straight. So in that particular instance, it certainly caused his conviction, probably as much as all the other evidence that the state put on in Murdaugh. In this case, we'll have to wait and see what actually happens as far as a jury verdict goes. Once I find out what that is, I will let you know. But I thought this was an interesting case, and it reminded me of a case that came up while I was practicing as a respiratory therapist in a little town called Quincy, Illinois, back in the 1980s. We had a great ambulance crew and a really active advanced EMS system in Quincy, Illinois. And I was friends with most of the paramedics. There was a great guy there by the name of John Landis. He and I were good friends. We talked often. A lot of times I would go down and visit with them in their ready room and just have fun talking about different things that we'd done because I had been a paramedic at one point. And so I started to have all kinds of abdominal problems, and so did some of the other paramedics. They got really, really sick, and what they found out was that somebody was dumping arsenic in the iced tea that they were making and keeping in the ready room there. Somebody was dumping in arsenic because they used taro ant poison, which is very, very sweet, and it's laced with arsenic. It's designed to kill ants. And those people were getting a boatload of arsenic. And I don't know whether I got some or not. I don't remember ever drinking that tea down there. But to make a long story short, there was a doctor there by the name of Mike Swango who was working as a paramedic. Now I know what you're thinking. What's a doctor doing working as a paramedic, right? Well, here's the deal. He went to University or Ohio State University and to their hospital there to be a neurosurgery resident. And in his first year of neurosurgery, the nurses noticed a rather funny situation where that doctor would visit a patient, he'd leave, 10 minutes later that patient would suffer a cardiac arrest, and that doctor would be the first one on the scene and would administer the drugs and get the guy back. Apparently, he had a hero complex, which morphed into a complex designed to kill people. And indeed, he killed several people at the Ohio State University, and then he came to Quincy, and he got caught. He actually appeared, it was either on Primetime Live or Nightline or one of those shows, where he said, yeah, I had recipe cards to make the poison ricin, which is untreatable. There is no antidote for ricin. But, you know, I'm a scientist. I'm a doctor, so I'm a scientist, and I wanted to experiment with that. Why anyone would experiment with a substance that is always fatal is beyond me. But that's what this guy did. So he was sentenced to prison for 2 years as a result of the assaults that he did on the paramedics. When he got out, he went on to get a residency in the Great Northwest, and over time that followed up with him, and they found out that he had been convicted, so they discharged him from that residency. And eventually he went to Nigeria, killed some patients there, came back to the United States, went to work for the VA in New York, killed some patients there, and then he left the country again to go to Saudi Arabia. They didn't want him. They sent him back, and when he landed at Chicago O'Hare, the FBI nabbed him. He's now in the Supermax prison in Florence, Colorado, where he should have been a long time ago. That is what happened with Swango, and I actually lived through that. I saw what happened to some of those paramedics. I mean, it really got to them. And when you don't trust the people that you work with, that's a really bad situation to be in. So, like I said, I will bring you the result of that trial. They don't have that TV trial. They don't have the trial on TV. They haven't streamed it in any way. Federal courts routinely do not allow cameras in the courtroom, which I think is a big mistake, but they don't. And so, as a result of that, we don't have any video from it, but I will report on it when I hear what the verdict is. That's what I have for you today. Thank you very much for watching. I have recently released some shorts that offer some suggestions for how you might do a kindness. And with that, I'll tell you that if you have any comments here, leave them in the comments down below. And if you would like, you can email me with any kind of video requests that you might have. Thanks again for watching, and catch me down here at the beach again next time. If you like this video, here are a few others you might try, and don't forget to subscribe. Have a terrific day, guys.